I think we're live.
It said this live should start soon.
There we go. Okay, I think we're live. I don't see comments and things like that, but this is our first. Okay. Oh, it's a little delayed. Okay. It is lunchtime on Tuesday, September 1st. We can't believe it's September. It's crazy. What happened to our summer? We'll see if some people pop on. There's Sarah. Hi, Sarah. You got your reminder. This is our first Facebook Live for Kaczmarski Hearing Services. We want to do several of these. I'm not going to make them very long. I'm going to keep people's attention. But we had some questions come in that we posted a week ago of people who had some curiosity that we'd like to solve their questions. So we've got Brooklyn on, and we're ready to go. So we had asked our Facebook audience for 5 questions about hearing loss in general. So our first topic is just generally questions about hearing loss. And the first question we got was, what are the symptoms of hearing loss? The symptoms of hearing loss vary from person to person, all ages. Just a little bit of background that there are about 28 million people with hearing loss in the United States. It's crazy. Lots of people that would need a hearing test. It affects all ages. It takes some time to figure out because you're not so sure if it's hearing loss or something else, or if it's husband and wife. If the wife is talking and the husband can't hear, they blame each other when it might be a hearing loss. So there's lots of things to watch out for. Difficulty hearing conversations and background noise is the biggest thing that we hear, and that is something that is where people want to be social, is where people want to go out and have lunch and be social and listen to their friends across the table. And when things start to get muffled and muddy, just kind of not so clear, that is when that's a first clue that you might need to get a hearing test. Some other symptoms of hearing loss is a hissing, roaring, or ringing in the ears, and that's called tinnitus. Also, tinnitus is also the correct way of saying it, 2 different ways of saying that. And we'll have a whole nother Facebook Live on tinnitus itself. So we'll address tinnitus a little bit today, but that is one of the symptoms of hearing loss. Difficulty hearing on the television or the radio when you're turning the television that has a bar across the bottom of how high the volume is going. If that starts creeping over to the right, you know that it's time for a hearing test because you need it louder than the rest of the people in the room. Same with the radio and the songs in the car. Sometimes the hearing loss symptom is just being really, really tired, just wiped out from the day. It's like, why am I so tired? It's from listening really hard all day. You're always like this trying really hard to hear. That can be very draining. So if you've had a long, long, long day, it might be because you're not hearing as well as you could be, and your brain is looking for that information. Another symptom of hearing loss can be dizziness and problems with balance. It's connected to the same fluid systems in our head. The vestibular system is connected to the hearing system, so sometimes those are interrelated, and we will always start with a hearing test for those types of issues. And then the biggest one of all, I'm always asking asking people to repeat themselves. That's a huge, huge symptom of hearing loss. That's very, very obvious to other people. Maybe not necessarily the person with the hearing loss, but the other people will notice that. I say, just talk louder. Well, sometimes you just need to slow down, like me, and talk clearer. And sometimes rephrasing things is a nice way to get somebody to hear you better. Instead of saying the same thing 4 times, say it a different way instead of repeating things that many times. The second question is, how is hearing loss diagnosed? Hearing loss is very, very gradual. It sneaks up on people, and they wonder if they even have a hearing loss. And so we diagnose that with a hearing test. It's the first step. And if you go to a certified audiologist, a doctor of audiology, you will get a diagnostic hearing test. Instead of going to a clerk or a machine, that type of thing, you'll get a full diagnostic hearing test where we'll take a complete look at all the systems of hearing, of how the thresholds and how loud things need to be. We test the words and how clear things are, and we also test speech and noise, And we also do things like tympanometry, where we look at the health of the eardrum and the middle ear system. So that's how hearing loss is diagnosed. We recommend a hearing test every 6 to 12 months once a hearing loss is diagnosed. That is very, very important to monitor the hearing, because sometimes the changes are very, very slight, and you want to make sure that that we monitor that and get that on paper and make changes if we need to. Another question is hearing all the same? Hearing loss all the same? No, there are different kinds of hearing loss. The two main types of hearing loss is sensory neural hearing loss and conductive hearing loss. Sensory neural hearing loss is the most common nerve hearing loss, and that is where it's permanent in the hearing nerve. And that's most of the time due to age or noise exposure or damage to the hearing nerve with prescription meds or head injuries, that type of thing. Conductive hearing loss is more of a mechanical hearing loss, where the sound is being inhibited from getting to the nerve. So there's something holding the sound back from getting through to the nerve. And that's most of the time a ear infection or fluid building up behind the eardrum. Many times those things are treatable. We refer those people to our ear specialist for a medical diagnosis of the conductive hearing loss. And sometimes there's a mixed hearing loss. The sensory neural system and the conductive system talk to each other all the time, and if the sound can't get through to the nerve, that's one thing, and then maybe there's also a hearing loss in the nerve. So we will do a full hearing test to see the differences and what kind of hearing loss you have. Is hearing loss all the same? No. I can see 50 people with the same hearing test, and they'll all perform differently. The hearing mechanism is just a pathway to the brain. So many times we're working more with the brain than we are with the ear. It's a pathway to the ear. If you think about it, it's amazing that I can say the word balloon and my son can say the word balloon, but you'll know that one is a male and one is a female, or one is older or younger. All those little innuendos and those little things that the brain interprets. It's a very complex system. So another question is, what do I do if I think I'm losing my hearing? Well, the first step is to get it on paper and take that step to make the phone call to make a test, appointment for a test with a certified doctor of audiology. That's what's most important. Just get it on paper as a learning tool to know how the system works, what your lifestyle is like, what your past is, noise exposure. Have you ever had ear infections in the past? Any trauma to the ear? Do you have any dizziness or plugged feeling in the ears? We go through all these things in order to properly diagnose a hearing loss. And if it's normal, we just recommend that you have a hearing test every 3 to 4 years. And if there is a hearing test that shows a hearing loss, that we will either treat it with hearing aids or other therapies. And or if it's very, very minimal, we'll just talk about strategies for listening and understanding in difficult situations, and recommend that you have it tested every 6 to 12 months. That is something that we are very, very good at Kaczmarski Hearing Services. One thing I wanted to touch on is the impact of untreated hearing loss. Untreated hearing loss now, there's many studies pointing to cognitive decline in persons who are not hearing their world correctly, and that can lead to depression and anxiety and withdrawal from social situations. If Uncle Joe doesn't want to come to the family reunion anymore because he's not hearing, it's no fun for him anymore. And the social withdrawal is what life is for. It's all the good things in life to enjoy. We want to make sure that they stay connected in life. Even through the shutdown and the pandemic, we found that most of our patients were very, very happy that we were open for emergency situations, so we could keep them connected with the community and what was going on their TVs. And it's very, very important. People will worry more with the hearing loss. They're not sure of their surroundings for emergency situations. So a lot more anxiety can happen with untreated hearing loss. And insecurity, just emotional turmoil, insecurity, those types of things all add up with when you're not hearing your environment correctly. So that is something that is a great thing that we see when somebody gets their hearing tests, appropriately gets hearing aids with the right technology within their budget, they come back with their shoulders relaxed, everything's nicer, they're much more happy to engage. It's just a very, very positive thing when it's done right, very much so. Our last question is, can continuous tinnitus cause hearing loss? That's a very, very good question. And I'm going to say that the answer is not necessarily no, but we're going to have a whole Facebook Live on tinnitus individually. So we're going to address that more in the next Facebook Live. But tinnitus is a symptom of hearing loss usually. So when somebody has tinnitus, the first thing to do is to get a hearing test and see if the hearing nerve is affected at all. So those are the kinds of things we're looking for with tinnitus. Tinnitus is a very individual symptom, and we look at a lot of medical reasons for that along with the hearing test. So that's a whole additional evaluation for our patients. So I hope you've enjoyed our Facebook Live, where we're going to record these and post these on our website and on YouTube, our YouTube channel. And I hope you enjoyed this, and we're going to again post more subjects and questions on our Facebook page that you can participate with and get your question answered. So I really hope that you enjoyed this. Let's see, we got 11 minutes in, so I think that's a good time to end this video. So thank you very much for participating.